What if depression is not one illness? What if anxiety is not one illness either? What if the word we have used for decades, mental illness, is actually the reason millions of people never get better? That is the argument Dr. Daniel Amen makes in his book, The End of Mental Illness. Amen is a psychiatrist who has spent his career looking at actual brain scans of his patients instead of just asking them questions from a checklist. And what he found broke the standard model of psychiatry apart. He found that two people who both get diagnosed with depression can have completely different brains. One might have low blood flow, another might have high inflammation, a third might have an old head injury nobody ever noticed. Same label, three different problems. And if you give all three the same pill, only one of them is likely to get better. In this video, I am going to walk you through this book chapter by chapter. You will learn why Amen thinks the term mental illness needs to disappear, what he found when he looked at over 150,000 brain scans, and the 11 risk factors he says are quietly damaging your brain right now. Stay until the end because I will also cover where scientists and doctors push back on his claims, so you get the full picture and not just the sales pitch.
Here is how this breakdown is structured. First, we cover the introduction and the first 4 chapters, where Amen lays out his core argument, the history of psychiatry, and why he believes imaging the brain changes everything. Then we go through the heart of the book, his Bright Minds framework. 11 letters, 11 risk factors that damage brain function. I will take you through every single one with the real chapter content behind it. After that, we cover the final chapters, where he talks about the other parts of health beyond biology, how to track your own numbers, his diet approach, and how he wants to apply all of this at a larger scale in schools, families, and workplaces. We will close with the overall verdict, the criticism this book has received from the scientific community, and whether it is worth your time.
Let's start at the beginning. Introduction. Why I hate the term mental illness, and you should too. Amen opens by attacking the phrase itself. He says calling something a mental illness makes people think the problem is in their character or their will. Nobody says a person has a broken ankle disorder. They say the ankle is broken, you treat the ankle, and it heals. Amen wants the same logic applied to the brain. If your brain is not working right, your mind will not work right. And that is a medical problem, not a personal failing. He points out that despite decades of medication development, rates of depression, anxiety, and suicide have not gone down. He argues this is because the field has been treating symptoms without ever looking at the organ producing those symptoms. Nobody would treat chest pain without ever scanning the heart, yet psychiatry has largely done exactly that with the brain. The point he wants you to walk away with before Chapter 1 even starts is this. Stop blaming yourself or people you love for how their brain is behaving and start asking what is actually happening inside that organ. Chapter 1. From Demon Possession to the 15-minute med check. This chapter is a short history lesson. Amen walks through how mental illness has been explained across history, starting with the idea that people were possessed by demons, moving through asylums, then Freud and talk therapy, and finally landing on today's model, where a patient sees a psychiatrist for 15 minutes and walks out with a prescription based only on a conversation. He describes how the current diagnostic manual groups patients by symptom clusters. 2 patients can answer a checklist the same way and get the same diagnosis, say major depressive disorder, and be given the same drug, even though their brains might be doing completely different things. Amen's point is that we have gone from mystical explanations to modern ones, but we skipped the one step that actually matters, looking at the brain itself before deciding on treatment. Chapter 2. Making invisible illnesses visible. This is where Amen introduces SPECT imaging, the tool his clinics are built around. SPECT stands for Single Photon Emission Computed Tomography. Instead of showing brain structure like an MRI, it shows blood flow and activity, so you can see which parts of the brain are working too hard, which parts are underactive, and where there might be damage. He shares case after case from his own clinic. A woman labeled as bipolar and treatment-resistant for years turns out to have scan patterns consistent with past head trauma nobody had ever asked her about. A teenager labeled as having severe ADHD turns out to have a scan pattern that responds to a completely different approach than stimulant medication. These stories are the emotional core of the chapter. Eamon argues that if you would not let a mechanic fix your car without popping the hood, you should not let anyone treat your brain without ever looking inside it. Chapter 3: 12 Guiding Principles to Change Your Life. Here, Eamon lists 12 core beliefs that guide his whole approach. Some of the ones he repeats most through the book: your brain is involved in everything you do. When your brain works right, you work right. And your brain is soft, roughly the consistency of soft butter, sitting inside a hard skull, which is why trauma to the head matters more than most people think. He explains that the brain only makes up about 2% of your body weight, but uses around 20 to 30% of the calories and oxygen you take in. That single fact is used to justify why blood flow and nutrition end up mattering so much later in the book. These 12 principles function as the operating rules for the rest of the book. Every later chapter about diet, sleep, or toxins traces back to one of these 12 ideas.
Chapter 4: Get your brain right, and your mind will follow. This chapter introduces what Eamon calls the 4 circles model. He says mental health is shaped by 4 overlapping areas: biological, psychological, social, and spiritual. Most of the book focuses on the biological circle, because Eamon believes it is the most overlooked and the most fixable. But he is clear the other 3 still matter. Inside the biological circle, he introduces 11 risk factors that can damage brain function. He bundles them into a single acronym so people can remember them: Bright Minds. This is the acronym the entire second half of the book is built around. From here on, the book stops being about theory and starts being a checklist. Each letter of Bright Minds becomes its own chapter, its own risk factor, and its own set of fixes. Now that the foundation is set, let's move into the core of the book. 11 letters, 11 ways your brain can be under attack without you realizing it. I'll go through each one the same way: what the risk factor is, an example from the book, and what you can actually do about it.
Chapter 5: B is for blood flow. Blood flow is the first and, according to Eamon, the single most important factor. Low blood flow shows up on scans of patients with depression, ADHD, and dementia more consistently than almost anything else he tracks. He lists common blood flow killers: too much caffeine, nicotine, marijuana, alcohol, and a sedentary lifestyle. He also mentions that low blood flow is one of the strongest predictors of Alzheimer's disease he has seen across his scan database. Exercise, hydration, and cutting back on substances that constrict blood vessels are the fixes he pushes hardest here. He frames this as the foundation everything else sits on top of. Chapter 6: R is for retirement and aging. The chapter title sums up the idea directly. When you stop learning, your brain starts dying. Eamon argues that mental stagnation, not just age itself, is what accelerates cognitive decline. He compares patients who kept learning new skills into their 60s and 70s with patients who stopped challenging themselves after retirement. The scans of the second group show more shrinkage and lower activity in areas tied to memory. His advice is to keep learning something new and slightly difficult for your whole life, whether that is a language, an instrument, or a new field of study. Novelty and challenge are what keep the brain active, not just puzzles you are already good at.
Chapter 7: I is for inflammation. Eamon connects chronic inflammation in the body directly to depression, anxiety, and brain fog. He describes inflammation as a fire that, when left unchecked in the body, eventually reaches the brain. He points to gut health research showing that an unhealthy gut microbiome is linked to higher inflammation markers and worse mood outcomes. He also discusses omega-3 fatty acids and their role in lowering inflammation, citing studies where supplementation improved mood symptoms. Reducing processed food, healing gut health, and getting enough omega-3 fats are the main levers he recommends for lowering inflammation and, by extension, protecting mood. Chapter 8: G is for genetics. Eamon makes a distinction here that matters a lot. Genetics loads the gun, but environment pulls the trigger. Having a family history of a condition raises your risk, it does not guarantee the outcome. He discusses epigenetics,
the idea that your genes can be switched on or off based on your environment, stress levels, and habits. He shares patient cases where knowing a genetic risk led to earlier lifestyle changes that appeared to prevent the condition from ever fully developing. His message is that your family history is information, not destiny. Knowing your risk lets you act earlier instead of waiting for symptoms to show up.
Chapter 9. H is for head trauma. Ayman treats head trauma as one of the most underdiagnosed causes of mental health symptoms. He says many patients had a head injury they do not even remember, sometimes because they were too young or because it happened during a moment like a car accident or a fall. He describes scan patterns from former athletes and accident survivors where damage from old injuries lines up almost exactly with symptoms like mood swings, memory issues, or impulsivity that had been misdiagnosed as separate psychiatric conditions for years. He recommends checking for a history of head injury, even minor ones, and considers treatments like hyperbaric oxygen therapy for patients where trauma is confirmed. Basic prevention, seatbelts, helmets, avoiding risky falls, gets repeated often.
Chapter 10. T is for toxins. This chapter covers substances that damage brain tissue over time, from obvious ones like alcohol and drugs to less obvious ones like household chemicals and mold exposure. Ayman discusses patients exposed to toxic mold in their homes who developed symptoms resembling anxiety and cognitive decline, symptoms that improved significantly once the mold exposure was removed. He also flags endocrine disruptors found in common health and beauty products. He recommends auditing your environment, checking for mold, reducing exposure to certain plastics and chemicals, and being cautious with recreational drug use, given how it shows up on his scans.
Chapter 11. M is for mind storms. Mind storms refers to abnormal electrical activity in the brain, along with untreated mental health conditions themselves. Ayman argues that leaving something like depression or anxiety untreated is not neutral. It actively damages the brain over time. He cites research connecting untreated depression to a higher long-term risk of dementia, framing early treatment as brain protection, not just symptom relief. Do not wait out a mood or anxiety disorder. Getting it addressed early is framed here as one of the most protective things you can do for long-term brain health. Chapter 12. I is for immunity and infections. The immune system and the brain are more connected than most people assume. Autoimmune conditions and untreated infections can produce symptoms that look exactly like a primary psychiatric disorder. Ayman shares cases of patients with underlying infections or autoimmune flare-ups whose brain fog and mood symptoms were originally treated as standalone psychiatric issues and only improved once the immune or infection issue was addressed directly. If standard treatment is not working, he suggests checking for underlying immune or infection-related issues rather than simply increasing medication doses. Chapter 13. N is for neurohormone issues. Hormones like thyroid hormone, estrogen, testosterone, and cortisol directly affect brain chemistry. An imbalance in any of them can produce mood symptoms that mimic other conditions entirely. He describes patients going through menopause or thyroid dysfunction being diagnosed with depression or anxiety disorders when the underlying cause was hormonal and improved substantially once hormone levels were corrected. Get your hormone levels checked before assuming a mood issue is purely psychological. This is one of the more overlooked risk factors in his framework. Chapter 14. D is for diabesity, urohormone issues. Diabesity combines diabetes and obesity into one category, and Ayman treats both as direct threats to brain size and function, not just physical health issues. He references research linking higher body fat and blood sugar dysregulation to smaller brain volume over time, along with a higher risk of dementia later in life. Managing blood sugar and weight is framed here as brain care, not just body care. He pushes readers to treat these numbers as seriously as they would treat a mental health symptom. Chapter 15. S is for sleep. Sleep is the final letter, and Ayman calls it one of the most underrated risk factors of all. Without enough sleep, the brain cannot properly clear waste, form memories, or regulate mood the next day.
He discusses studies on sleep deprivation, showing measurable drops in concentration and emotional regulation after just 1 or 2 nights of poor sleep, along with longer-term links between chronic sleep loss and cognitive decline. Protecting 7 to 8 hours of consistent sleep is treated as non-negotiable in his framework, on the same level of importance as diet or exercise. That's all 11 letters: blood flow, retirement and aging, inflammation, genetics, head trauma, toxins, mind storms, immunity and infections, neurohormone issues, diabetes, and sleep. Amen's argument is that most people struggling with their mental health have one or more of these quietly working against them, and standard treatment never even checks. Now let's look at what he covers beyond the biological circle and how he wants people to actually put all of this into practice.
Chapter 16. The Other 3 Circles. Remember the 4 circles from Chapter 4: biological, psychological, social, and spiritual. After spending most of the book on the biological circle through Bright Minds, Amen returns to the other 3. He argues that thought patterns, relationships, and a sense of meaning or purpose all interact with brain health, and none of them work in isolation. He discusses how negative or automatic thought patterns can be identified and corrected, similar to cognitive behavioral therapy techniques, and how strong social connection is linked to better outcomes across nearly every condition he studies. Fixing your biology is necessary, but not sufficient on its own. He wants readers to work on their thinking patterns, their relationships, and their sense of purpose alongside the physical changes.
Chapter 17. You cannot change what you do not measure. Amen pushes readers to get actual numbers on their health, rather than relying on how they feel. He lists specific labs and metrics he considers essential, things like blood sugar, inflammation markers, vitamin D, and thyroid function. He describes patients who felt certain nothing was physically wrong with them, only for blood work to reveal a vitamin deficiency or thyroid issue that was quietly driving their mood symptoms the whole time. Get blood work done, track the numbers over time, and treat those numbers as part of your mental health care, not something separate from it. Chapter 18. Food made insanely simple. This chapter lays out his Bright Minds diet approach. His first rule is to only eat foods that love you back, meaning foods that support blood sugar stability and reduce inflammation, rather than spike it. He specifically calls out highly processed food, foods sprayed with pesticides, high glycemic foods that spike blood sugar, and low-fiber food products as the real threats to brain health, more than any single nutrient people usually worry about. The diet advice boils down to eating whole foods, watching sugar and processed carbohydrates, and prioritizing fiber and healthy fats, all in service of protecting blood flow and lowering inflammation from the earlier chapters. Chapter 19. How to make a massive difference. The final chapter zooms out from the individual to institutions. Amen wants Bright Minds principles applied inside families, schools, businesses, and churches, anywhere groups of people spend time together regularly. He gives examples of schools that introduced brain health education and saw behavioral improvements in students, along with workplaces that saw productivity gains after addressing employee sleep and blood flow habits. His closing argument is that brain health is not just a personal project. It is something that can be built into culture at scale, starting with the institutions people already spend most of their time in. So how does all of this connect? Amen's central thesis runs through the entire book. Mental illness is not one thing. It is the visible output of a brain that is not working right. And that brain trouble usually comes from one or more of 11 identifiable causes. Fix the cause, and the label often stops applying. The book has real strengths. It pushes people to stop assuming their mood problems are purely psychological or purely a matter of willpower. It makes a strong case for basic health metrics like blood sugar, hormone levels, and sleep quality, things that plenty of standard psychiatric care skips over completely. And the case stories, even when used to sell his approach, are genuinely useful for showing readers what an overlooked physical cause can look like. My honest read on this book: treat the 11 Bright Minds factors as a genuinely useful health checklist, because most of that advice holds up regardless of what you think about SPECT imaging. be more skeptical of the imaging claims themselves. And if you are drawn to that part, look into the research independently before spending money on a scan. Now for the criticism, because you deserve the full picture. Amen's SPECT imaging approach is not widely accepted by mainstream psychiatry or neuroscience. Professional organizations have pointed out that there is limited peer-reviewed evidence supporting the use of SPECT scans to diagnose specific psychiatric conditions or to guide individual treatment plans. Critics have also raised concerns about the cost of these scans at his clinics and whether the evidence supports the price tag. So, while the underlying advice around blood flow, sleep, diet, and inflammation lines up with a lot of solid general health science, the specific claim that brain imaging should be a standard diagnostic tool is still contested. If you found this breakdown useful, let me know in the comments which risk factor surprised you the most, and subscribe for more book breakdowns like this one.